Hey guys, welcome back to another episode of the SMA Victor Podcast. I am your host, Victor, who also goes by Victor the Inspiration online and on social media. I came across this post by SMA News today on Instagram, and these guys help spread SMA awareness. And I came across this post, and I wanted to make a video talking about it for this YouTube channel. So it says, "Big news in SMA." Now, this was uploaded April 3rd. This was posted April 3rd, so I'm currently showing this like 3 weeks later. So I'm a little bit late on this, but I wanted to touch on this topic because I was very, very curious. I personally have not looked into it, so me reviewing this with you, I'm reviewing this in real time with you as well. So it says, Scholar Rock is preparing to resubmit its application to the FDA for Apitegromab? Gromad? Why does it need to be resubmitted? Previously, the FDA rejected the application due to manufacturing concerns at a third-party facility. Interesting. Let's just call it the medication, is a muscle-targeting therapy designed to block myostatin, a protein that naturally limits muscle growth, thereby encouraging improved muscle function. The medication has the potential to complement existing SMA therapies by enhancing their effects while also improving motor function outcomes and helping address ongoing unmet needs in SMA care. So it's a new medication. What's the timeline? Following FDA reinspection, the application is expected to be resubmitted with a potential approval and launch of the medication sometime in 2026. And so I looked up the medication here, and again, this is real time me watching it with you as well. So I just simply copied and pasted the medication. So it says, parentheses SRK-015 is an investigational muscle-targeted anti-promyostatin monoclonal antibody developed by Scholar Rock to improve motor function in patients with SMA types 2 and SMA type 3. It acts by selectively inhibiting myostatin activation, aiming to boost strength and muscle mass, often used alongside standard SMN targeted therapies. It says key aspects of the medication. So what is the purpose? Developed to improve motor function in SMA patients, specifically as a potential treatment for children and adults. Mechanism. The medication is a fully human monoclonal antibody that binds to pro/latent myostatin, inhibiting its activation, a regulator of muscle growth. It says clinical trials, the phase 2 Topaz trial and its extension indicated positive long-term and sustained improvements in motor function. It says administration. It is administered via intravenous IV infusion, typically every 4 weeks. Okay, that's pretty cool. Side effects. Common adverse events reported in trials include headache, upper respiratory tract infection, fever, cough, and the common cold. Regulatory status. Following a September 2025 FDA complete response letter requesting facility but not safety/efficiency changes, the company is moving forward with regulatory steps, including a potential 2026 European launch. So it says the medication is designed to be a muscle-targeted therapy, setting it apart from existing therapies that focus on motor neuron degeneration. So this one, oh, that's really interesting. So we'll look this up. Let's just pull up one of these articles. So this medication specifically focuses on the muscles and not the neurodegeneration. That's really interesting. So this is Scholar Rock. FDA issues complete response letter for the medication as a treatment for patients with spinal muscular atrophy. solely related to observations identified at Catalent, Indiana, LLC. Okay, so this was in September. Is there a new one? I'm just genuinely curious. Or let's check this one out. Let's read this one out. We are investigating the medication, a muscle-targeted therapy with the aim of improving motor function for people living with SMA who have been treated with certain existing SMA therapies. Scholar Rock is the first company to show clinical proof of concept for an investigational muscle-targeted therapy in SMA. This is actually really, really cool. Despite significant advances in SMA treatments, progressive muscle weakness continues to be a hallmark of the disease. Existing treatments do not directly address the muscular components, including muscle atrophy and weakness that can lead to deterioration in mobility, swallowing, and breathing and cause excess fatigue and exhaustion. It says strong clinical and preclinical evidence indicates that the medication has the potential to improve motor function while minimizing adverse effects. If ongoing trials are successful and the medication is approved, it could open a number of potential benefits above existing SMA treatments, such as sustained or improved motor function intended to provide better quality of life for those living with SMA. The medication is a selective inhibitor of latent myostatin. Myostatin is a protein expressed primarily in skeletal muscle that regulates muscle mass. When myostatin is activated, it works with other growth factors and hormones to inhibit muscle growth. Unlike most myostatin inhibitors, the medication selectively targets the latent, or inactive form of myostatin to block its activation in the muscles. So this primarily targets the muscles, which is really, that's actually really cool. I'm glad we actually gone over this topic together. I apologize in advance too if I'm pronouncing these words wrong. Please let me know. Like, can you pronounce some of these medications? Not just with Spinraza, but just medications in general. I find it very interesting, and one of my most curious thoughts is how do they come up with these kind of names? Some of these names are kind of out there, right? So I hope you guys gained value from today's video. If you guys did, please like the video, comment down below what you personally learned within this video. And even in addition, if you guys even heard about this medication. Now, if you guys are not following SMA News Today on Instagram, please do so. It is ran by a great friend of mine who is spreading SMA awareness. And I came across this post. I had it in a folder, and I wanted to make a video talking about it with you guys as well. I love you guys. I appreciate you guys. And as always, remember, grow through what you go through. Much love.